Hello, everyone. This is Jeremy Murphy. I'm in Lincoln, Nebraska, and I'm excited to be with you today. I'm a health coach. I'm a certified health coach with the Dr. Sears Wellness Institute. I'm also a certified running coach with the Roadrunners Club of America. And today I'd like to talk to you about relieving inflammation naturally. And there's a threshold question of can we do this or not? And there are differing opinions on that, but I think it's becoming clear that we can relieve a great deal of our inflammation naturally. And I'll explain why that's important, how this has become a personal journey for me, and really how all of us can use different tips, tricks, techniques to deal with this issue. It's an issue that becomes more prevalent as we age, and it's something that I think a lot of us have a wake-up call with inflammation issues that really causes us to change our diet and reevaluate what we're putting in our bodies. So before I proceed further, I'm going to make sure I tweet this out so that others can be aware that we're on the air. So we'll go ahead and do that. Let's see. Okay, so where do we find our information on inflammation, and how do we get to a point where we really reevaluate the doctor-patient relationship? And I need to explain, I'm not a doctor, I'm a health coach. I help people improve their health in a holistic way using health and wellness techniques that are within the bounds of what we as health coaches are allowed to do. But I've tested some of these things myself, and they've worked. And so I'm excited about that. And I'll talk about how personal this got with asthma and bronchitis. I've had asthma since 1979 is when it was first diagnosed. So I'm going to talk about, the steps that I've taken to try to really take more control of my own health and to make self-care really the answer to, my version of the nation's healthcare crisis. So before proceeding further, I want to cite my source. And so the main source for this material is a book called The Inflammation Solution. The book is written by, sorry about that, lost control of the blab for a second. The book is written by Dr. Bill Sears, and it's called The Inflammation Solution. I'll hold it up so you can see it. When everything works and nothing hurts. So we've already identified that pain is a link to the inflammation. And when the inflammation gets out of control, it causes pain, swelling, and other illnesses that end in itis, interestingly enough. And I've never had or seen doctor link all these illnesses or diseases to end in itis and say that there's a common cause that's creating all these conditions in different parts of the human body, but it's related. And so that was a very powerful insight for me. So I'll type in the Inflammation Solution by Dr. Bill Sears. Okay, so I want to welcome Megan. Thanks for joining us. We're talking about inflammation today and how we can relieve inflammation naturally. So I'm just going through some different materials from Dr. Bill Sears from a book that he has, The Inflammation Solution, When Everything Works and Nothing Hurts. And he talks about healing hurts, mellowing moods, controlling weight, and easing illnesses and diseases that end in itis. So for me, the chief one I was interested in is bronchitis because of the link to asthma. But also I noticed on his list was gingivitis. And that's a personal one too, because my dad is a retired dentist and my youngest sister is a dental hygienist. So our family has a lot of experience. My dad was an active dentist for 40 years or so. And so we did a lot of assisting in his office, helping other patients with different conditions they would have, regular checkups, removing popcorn kernels from their teeth, and of course, a lot of the patients had gingivitis. And you wonder why. And, according to Dr. Sears, a lot of the reason is because of the inflammation being a part of the body. So once again, I want to let you know, I am a certified health coach. I'm a certified running coach. I'm not a doctor, but I have tested some of these ways of reducing inflammation in my own life, and others have too, and have found dramatic results with it. And I'll talk about that as we go through this material. My running blog is at runninggrooveshark.com if you're interested. My health coach website is being built right now, so I don't have a website to send you to there. But if you're interested in health coaching, probably the easiest way to get a hold of me is to contact me on Twitter. I'm Jeremy P. Murphy. You can see it up on my up next to my profile picture up here in the upper left. But I'd be happy to help with anyone that's interested in working on this issue or any other issues that you're concerned about with improving your health and wellness, taking control of your life, and really making self-care a part of your daily routine. So what is inflammation? We think about it. As a runner, I think of pain and swelling for some reason. And the interesting thing is that inflammation is frequently there before the pain or swelling may occur. And sometimes the inflammation doesn't quite reach that level. It might be kind of a mild discomfort. For example, like with your gums, if you floss too aggressively or brush too aggressively, I mean, you're going to have a little bit of inflammation of your gums. If you have gingivitis going with that, then you're going to experience that a little bit more dramatically. They're going to be a little more painful. So that's something to think about. But the inflammation is defined by Dr. Sears, by Dr. Bill Sears, as the body being on fire. So if we think about the body being on fire and the different ways that the body can be on fire, we just look at different parts of the body where these itis illnesses can occur. And I think that gives us a pretty good summary of really where inflammation can occur in the body. It can occur anywhere. So it can affect the brain with what's called cognitivitis or Alzheimer's. Gingivitis, we mentioned, is manifesting itself in the mouth with the gums, with pain, swelling, recession of the gums, things like that. Carditis is the inflammation manifesting itself in the heart. Bronchitis in the lungs. And this is the link to asthma. And this became a personal journey for me. And I'll talk about this a little bit right now because we're going through the itises, and this is the one that jumps out at me the most. But a year and a half ago, I went to see my asthma doctor, and I have to see her about every year to make sure I'm doing okay, see if I need refills of medication and things like that. And interestingly enough, I was struggling. I was training for my first 50K ultra marathon, and I was struggling. I couldn't figure out what the problem was. Well, my doctor tested my lungs. She said, you're having inflammation in your lungs, and it's more than I expected. And she asked if I was having trouble breathing and how much I was using my rescue inhaler, the albuterol. Just use some props to give you a visual aid. This is the, I guess it's ProAir is the, the inhaler that, I generally prescribe every year. We found that I was using that more than I should have been, suggesting that I was having more inflammation. So that reinforced my doctor's suspicion. So they increased my medication, and that did help. That was a really tough thing to accept because I run every day. And so my ability to breathe when I run is just a huge issue. And if I have interference from having problems with my breathing, I just, I'll cut my run short. Some days I'll take a day or two off, try to let the body heal that way. But I was pushing my body so hard with training, I didn't realize that is causing my lungs to get more inflamed. That, and I wasn't managing stress very well. And so that was eye-opening to me. And I had to figure out, well, how can I solve this quickly? Because 2 months after I saw my doctor, I was supposed to run my first 50K ultramarathon. And so after about a month or so of using, I don't know, they added a different inhaler, and I can't remember the medication. It's an orange inhaler, but I'm thinking of other drug names, and it's not. Yeah, I think it is Flovent. Thank you. I think Flovent did help, and I found that I had to take steps to reduce stress. And my wife at that point suspected that I was lactose intolerant. And I disagreed with that. And I said, oh, that can't possibly be right. I eat all this cheese and it doesn't matter and all this. And so I said, okay, well, I'll test it, see if anything happens. So I took lactose out of my diet, and just amazing things happened. I lost weight. I slept better. I felt better. I found that was, my body was reacting to the lactose and creating an inflammatory response, and that was working against me also. So, the asthma flares up, the lactose intolerance gets discovered. So I finally said, okay, I'm giving up lactose now. And so I'm pretty much giving it up entirely. I do consume Greek yogurt from time to time, and that doesn't seem to bother me, but it's not a daily thing. I try to keep a little bit of a watch on that. So, but the thing that I've noticed is there were nutrition changes that I could make, and it made a huge difference. Just made a huge difference. I was sleeping better. I was feeling better. I was having more energy. And so I got to October, 2 months after I saw my doctor, and she said, you've got inflammation in your lungs. I didn't bother to tell my doctor, oh, by the way, I'm about to run my first ultramarathon. I figured if things got worse, I was going to tell her. But if they didn't, I was going to tell her afterwards. So I ran my first ultramarathon in October of 2014. It went very well. I didn't have any problems. And since then, I've been trying to treat the inflammation issue a little more aggressively, or to deal with it preventively so it doesn't flare up, or if it does, so I notice it. And so, let's see. I have a question. How long without dairy before I notice an improvement? Oh, it's probably, it wasn't immediate, but I would say, within a week or so. I stopped drinking milk. I switched to almond milk and coconut milk. Even cashew milk is another alternative. And, sometimes I use coconut water in my smoothie or whatever. And, and my wife noticed. She noticed I was feeling better. I was having less gastric response to, drinking too much milk, drinking, eating too much cheese. The things that I thought were okay for me, but your body gets resistant to things when we get older. And I didn't notice any problems with lactose when I was younger. Maybe it was there and I just didn't realize it. And I had so many allergies that I was spending all my time avoiding soy and legumes and things like that. And it is important, if you do have allergies, you want to avoid what you're allergic to, because if you don't, you're going to have, additional problems will manifest themselves, and you want to try to make sure that those get resolved. So, so that's really how I dealt with, the dairy issue. Taking the lactose out of my diet helped a lot. And I'll go through some of the nutritional changes that I made in conjunction with what Dr. Sears talked about in his book. So, so that's how I would respond on the dairy issue. And thank you, Megan. Appreciate that. It was a big deal to be able to take my running to the next level and realize that I wasn't stuck at the marathoner level, so to speak. Not that that's a bad thing, but I felt like I wanted to try something at a different level of challenge and felt like I needed it. And so that's why I pursued it. So, okay, we talked about bronchitis. A lot of people have colitis. And I think, sometimes it could be hereditary. Sometimes it could be dealing with allergies or intolerances in the body. But I guess I have a couple friends that have colitis issues. Dermatitis is a big issue. People get allergic to things, or they have dry, itchy skin. And, the more you scratch, the more it aggravates the problem. It's just kind of a constant battle for people to have that. I do have a brother that's a dermatologist, so he deals with, dermatitis a lot, as well as, skin cancer and things that are much more serious than that. So another issue that a lot of us are encountering as we get older is arthritis. And I've never been diagnosed with this, but I'm 47 years old, and there are definitely people in my age group and older, people that are older, maybe over 50. You have a lot of people that are experiencing arthritis in their joints flaring up with overuse. Some people will try to be a hero and shovel the driveway instead of using their snowblower, things like that. It'll cause joints to act up. We just have to be more careful, and sometimes we just have to move slower as we age. We want to be in a hurry to get where we need to go and that type of thing, but we need to make sure that we do that carefully. You don't want to be in a hurry on snow and ice, for example, or out here right now in Nebraska, and I'm sure other areas of the country and the world. So just be careful for the conditions, and that'll help keep your joints a little bit better managed. So what happens with the inflammation when the body gets out of balance? If there's too much inflammation, and this is frequently the side that my body falls on, your body gets itchy, sneezy, and wheezy. You start to get the runny nose. You can't stop sneezing. Wheezing is a problem. The nighttime asthma sometimes seems to flare up for a lot of us that have asthma issues. That's just one way to look at it. With too little inflammation, a lot of us will just get sick and tired. We'll have a constant fatigue, or our body is a little bit more susceptible to picking up germs and illnesses, the flu that others might have. So it's kind of a balancing act. The body's trying to keep inflammation on an even keel and trying not to tilt it one way or another. And if it does tilt one direction, frequently a lot of us will kind of tilt one direction predominantly, and sometimes it'll go back to the other side, and suddenly we'll feel sick and tired, and then it'll go back to the inflammatory side. So I'm going to say hi to Travis. And we will, let's see, we'll continue here. Inflammatory drugs. The part of what brought this on, when I was a marathoner, before I became an ultramarathoner, I was a heel striker. And so I would strike, my heel when I would hit the ground. I would hit it harder than maybe I should, or maybe it was a repetitive injury. But I got this heel pain and swelling, and couldn't figure out what was going on with it. Inflammation. I'd ice the heck out of it. Couldn't get a handle on it. So I went to the doctor to see the doctor, and the doctor looked at it and said, "Wow, well, you don't have a lot of pleasant options here. One was to try Celebrex, which is a COX-2 inhibitor. So it manages the pain, but it has some side effects. And we've got to be careful with these side effects with drugs that we're on. Anytime you're prescribed a drug by a doctor, you want to look at what the potential side effects are. And you have the right to discuss those side effects with your doctor, with a pharmacist. My wife is a pharmacist, so I decline all the pharmacy counseling attempts at the pharmacy when I get my prescriptions filled. I just say, no, I'll talk to my wife. She'll tell me what's in it, what side effects are. She knows this stuff pretty well. But make sure you know what the side effects are, because I went on Celebrex for my heel and thought it was going to fix the problem. And what it did, it just ripped up my intestines. It ripped up my GI tract. It caused just lots of GI problems, discomfort. So it put a tiny bandage on the heel and ripped open my gut. So at that point, I said, "Okay, doctor, we're going to have to deal with this a different way. The Celebrex stuff is working." And so I decided I needed to figure out how to handle that differently. And so, I mean, eventually I figured out part of it was the shoes, and the shoes were too worn out, and, you know, the poor running form, improve the running form, and help resolve it that way. But be careful with these inflammatory drugs. A lot of them have secondary side effects. And for people that are runners, a lot of us we're relying too much on ibuprofen. In fact, runners, we call it vitamin I, and that's kind of in a derisive sense that, you know, we shouldn't be popping ibuprofen every day to deal with our pain. If we are, something's wrong. You know, the body goes through this inflammatory response. That's part of the body's effort to heal and repair the wear and tear. And if that's not happening and we're popping ibuprofen every day, I mean, that does cause liver damage. I think long term, I think is the side effect with that. There's some others also, but you know, there are different ways to deal with inflammation than you know, popping ibuprofen or taking the prescription medications. Now, a lot of people have extreme pain that has to be managed somehow. And, you know, that's what doctors are for. And the doctor and patient need to work on how much the patient can handle. And if the drugs are the best response. And sometimes maybe medicine is necessary along with ice. Sometimes compression helps, depending on what part of the body it is. Elevation can help. And of course, rest. The one thing that, you know, none of us seem to get enough of for some reason, especially if we are parents. Parents, we seem to get less rest than a lot of other people. So be careful with the inflammatory drugs, especially with the side effects, whether we're talking about ibuprofen or prescription drugs like Celebrex. I don't mean to pick on Celebrex relative to other drugs. It just happens to be the one prescription anti-inflammatory I can remember that did not agree with me. And if a doctor tried to prescribe it to me again, I would say, no, look, I have strong reasons to pursue a different course. Let's look at a different way to deal with this problem. So that's what I would say on the inflammatory drugs. You know, one thing that we forget about, our body needs omega-3, and we're eating all this omega-6, and so the balance gets out of kilter. And I was reading, when I read Dr. Sears' book, I noticed he said that omega-3 fish oil will help relieve asthma and bronchitis. And I said, that's interesting. I used to take that, and then I didn't think it really did anything for me. And so I stopped taking it. And but I found that going back to it and making sure that I'm taking fish oil 3 times a day, the omega-3, it does seem to help. It sounds unusual. It's not the traditional treatment for asthma and bronchitis. I mean, you don't exactly go to your asthma specialist and they don't pull out a pad and say, eat fish or go fish. But maybe they should. Maybe they should say go fish. So that, think about checking your omega-3 fish oil, see what's out there. I'm reading from Dr. Sears, the best fish oils are from either Alaska, or I think he was recommending one from Norway as a backup. And I've looked for the Norwegian one. I haven't been able to find it. It seems to be easier to find the omega-3 fish oil from Alaska for some reason in the store. So, but think about that if you haven't tried that, if you're having inflammation issues. give it a try. So, so I want to welcome Robin and Screamwax and Jesus. And we have a question from Robin, or no, from Screamwax, sorry. Thoughts on creatine? Oh, creatine, I've never tried it. I know others that are finding relief with, I'm trying to remember, it's, I think it's arthritis or joint pain or something like that that people are using it for. I think my brother has tried it, and, you know, some of the time it seemed to help him, and then I think he just gave up on it. So I don't know, I'd be really careful with things like that. I try to make sure that whatever you're putting in your body is natural, real food. And I think that's more important than, you know, we're all looking for the golden tonic, the magic bullet, and there isn't such a thing. You know, I think we have to recognize that that's the case, and to really take care of our own health, we have to look at it in a holistic sense and really analyze what we're putting in our bodies, and really reading food labels carefully, things like that. I will probably do some blabs on interpreting food labels later. I think you almost need a hieroglyphic decoder ring to figure some of those out. But yeah, you know, the omega-3, some people do complain about the, you know, the taste, or that it causes excessive burps. I've heard that too. I've never really had that issue. I just try to make sure that I drink a lot of water with it. And if I do, I don't really notice the taste. I love fish anyway. I love salmon and other fish as well, but salmon's really my favorite. So I don't have any problem with that. Yeah, see, you're talking about turmeric, and we're in the same wavelength because I have it right here. And I'll be talking about turmeric today. It's something I've been putting in my smoothies a lot, and it does seem to help. And having turmeric with black pepper increases the absorption by 1,000%, according to research cited by Dr. Bill Sears in his book, The Inflammation Solution. So if you're using turmeric, reach for the pepper too. I mean, if you're going to reach for one spice, you might as well maximize the absorption of it, make sure that it gets into the body at a higher level. And if you can boost it by 1,000%, why wouldn't you try it? So I'll talk about what I put it in. Primarily, I put it in my smoothies. But sometimes if I'm having chicken or something like that, and it just seems kind of bland, it needs some kind of spice to make it pop a little better, I'll just sprinkle, I would say like a dash on there. I don't know, if I'm on a day or two without having turmeric, I might double up or something like that, sprinkle a little more. I like to, it also makes your food more colorful. So think about that. Yeah, there is a synergy between mixing some of these foods and spices, and I'll talk about some of the ways we can do that in going through these things from Dr. Sears. Dr. Sears, in his book, he has a 12-step anti-inflammatory diet. And I want to go through all these 12 steps because I think the word is not getting out there as far as this being out there and this being something that people can easily do. And it does take some practice, and, we have to retrain ourselves to, have new healthy habits. But we all go through that. But I've found these to be very helpful, and I am trying to do all these in my own life, and trying to be really careful about how much I indulge, and if so, for what, and for what purpose or for what reason. So my indulgence has kind of become dark chocolate, 85 or 86% or higher. And so my wife will give me a hard time. She'll say, "Oh, I've got you some dark chocolate," but it's 72%. And I said, well, that's not dark enough. So sometimes I'll get 90% and I'll say, okay, that might be a little too dark. But the 56% dark chocolate is just not, it's not healthy enough to me. And there's research that, if you go a little darker, your body gets more benefit. If it's, I'm trying to remember what the break point is. I think it's somewhere between 72 to 80%. If it's that point or higher, your body tends to get more benefit from it. So think about that, as you figure out, which things you might indulge in. You might want to think about making your dark chocolate your indulgence, but looking at the percentage and making sure that you don't have to go crazy. You don't have to go to the point of 90%. I think might be going too far. Although for some people they might prefer that. They might prefer the taste of 90%. Or one, I just don't think there's much more health benefits past 85, 86%. So these are the 12 steps of the anti-inflammatory diet according to Dr. Sears. Number 1, grazing instead of gorging. We have this mentality that we have to eat as much as possible, not just on Thanksgiving, but at every opportunity. That if there's sugar out or unhealthy food, that we've got to reach for that. And we're all tempted by things that are unhealthy, but I think if we focus on grazing, on eating at regular intervals, eating smaller quantities at regular intervals, we do get some benefit for that. Benefit from that. Dr. Sears, he has what he calls a rule of twos. He says, eat twice as often, eat half as much, eat twice as long, 2 times as long, take twice the time to dine. So it is a little bit more time consuming to do this, but what he suggests is that fast eaters become fat eaters. And I used to be one of these people that if it was time to eat, I'd eat quickly. And part of the reason is I'm the oldest of 7 children. We had to eat fast in our family to get any pancakes or anything like that at the table. But I realized, if you're just eating mindlessly like that, you're really not doing anything to help yourself. And in fact, you're hurting yourself. You're making it tougher for your body to digest the food because you're not chewing it as well. So you have food that's partially unchewed down in your in your gastrointestinal tract, and your GI tract is saying, whoa, wait a minute, where the teeth come into this equation? Why didn't they chew this up a little better? So think about that, grazing instead of gorging. Number 2, smaller bites cause smaller spikes in blood sugar. So, sometimes we're trying to eat, we don't have a lot of time, we're eating huge bites, we're eating bites that are too large, and then we find that we've got to reassess how much we should be having in each bite. Sometimes we get food caught in our throat or whatever with that kind of thing too. So, it's better to be a little more cautious. Take the smaller bites, will cause smaller spikes in blood sugar. Number 3, eat salad first. Eat salad before you eat the rest of your lunch or dinner. Now, sometimes we have time to maybe take a salad with us if we're at work or something like that. But if we're at home for dinner or for lunch, we can certainly have a salad first, and it fills you up with something healthy. And then you don't have as much room for something that's unhealthy. Number 4, eat more seafood, eat less red meat. This is something that I've been doing with, I'm doing Meatless Monday. Almost every Monday, I don't eat any meat. So I try to find other things that I can eat. And so a lot of times I'm eating salmon or some kind of fish instead of the meat that I might otherwise eat. And same thing on Fridays. I don't eat meat on Fridays either. So pretty much using fish as the protein source for that day, along with some other veggies. Number 5, add veggies to your main course. Now, a lot of us will make the entree for dinner or for lunch. We forget about the vegetables. And then we wonder why our kids won't eat vegetables. Well, sometimes it's because they don't see them at the table. Now, sometimes they do see them at the table, and it might not be the particular vegetable that they want or desire or that happens to be in the house. So, but just remember to add veggies to the main course. Try to keep it a part of your routine. Number 6, healthy drinks to lower the sticky stuff in our blood. There are strong benefits with green tea, and I have done green tea with my daily routine. I try to drink like a cup or 2 a day of that. It does seem to keep your weight under control. It's kind of interesting to me. I didn't realize that before. It does also seem to just kind of fill you up a little more for reasons that I can't really identify. There is some research suggesting that wine might be helpful with this, but again, in moderation. I don't think there's anyone suggesting that you should drink a lot of it to, resolve the sticky stuff in your blood issue that some of us deal with as we age. Number 7, don't overcook your food. If you burn it, if you char it and then you eat it, it's harder to digest. It's not as healthy for us. So, it's better that we try to cook it properly. And sometimes that's tough to keep track of. If you're trying to multitask, cook while you're cleaning up in the kitchen or watching your child or your dog around the house. We just have to try to keep an eye on the food and make sure we don't overcook it. Number 8, care about your carbs. Eat good carbs instead of bad carbs. A lot of us are eating more sugar than we need to or should eat. And if you just look at the food labels and look at how many different varieties of sugar we're consuming in one item, it's really eye-opening. I mean, it's, you look at some labels and you just say, this shouldn't even be in our house. We should just throw this out right now. Why is this even here? So think about that. Read the food labels and try to interpret them. Number 9, partner your indulgences with anti-sticky stuff food. So, every once in a while, someone's going to, we choose to indulge a little bit. It might occur on major holidays. We just had Thanksgiving, Christmas, New Year's. And I think for a lot of people, it's just hard to, you're eating cakes and pies and, maybe more ice cream than usual. And, you might want to think about dark chocolate or coconut oil or coconut milk, something like that, to kind of offset some of the damage that the sugary, high-fat food might be bringing into your body. So, another recommendation of Dr. Sears is to add the omega-3 supplement to offset some of the damage of the indulgences that we might have. So maybe you take a omega-3 supplement like right before you indulge. And I think you're supposed to consume the omega-3 supplements with food. I think they're digested better if you ingest them with food. And of course, you want to ingest them with plenty of water too. Number 10, give your body an oil change. This one's interesting because I as someone who's allergic to soy, I've had to avoid soybeans, partially hydrogenated soybean oil is in just about everything if you start reading labels. And I learned that, that's a very unhealthy oil. And I knew that myself because I started avoiding it because of the allergy, and I just noticed benefits to my health. So, recommended oils to replace those harmful oils with are fish oil, olive oil, flax oil. Yes, Robin, I see you're saying flaxseed, and that's a common ingredient in my daily smoothie. I'll put flaxseed in there. But flax oil also, nut oils, and coconut oil. And, coconut oil, it's been debated a little bit, whether that's a healthy oil or not. And Dr. Sears previously had that classified as kind of a one to consume in moderation, and he did move it to the to good, healthy category of oil consumption. So, it's healthy to put, like half a tablespoon of coconut oil in your smoothie. Maybe a full tablespoon if you haven't had it for a couple of days or something. But it does seem to help. It's a middle chain fat, and it does help a lot. It does, it was eye-opening to me. A cancer survivor friend of mine gave me a smoothie recipe that she came up with. She just created it on her own, and it did have coconut oil, flaxseed in it, chia, almond milk, coconut milk, fruit, protein powder. And I kind of changed it and added a couple of things of my own. I, of course, wanted to put Irish oatmeal in it. So that's kind of the Irish blue kale smoothie that I have on my running blog. The recipe for it is there if you're interested. So those are oils that we can substitute to make our bodies a lot more healthy. Number 11, eat raw veggies. And we will age slower if we do that. So, and then let's see, number 12 is eat less, get less inflamed. Inflammation is a bad thing in excess because it leads to pain, swelling, and other issues. That we talked about the itis illnesses. Anything from bronchitis to gingivitis to cognitiveitis, dermatitis, carditis, arthritis, dermatitis, colitis. You just don't want to be dealing with these itis illnesses any more than you have to. And so these 12-step anti-inflammatory diet that's cited by Dr. Sears in this book is very helpful. So give it a try. Another thing that I recommend is that you just move more, track your steps. When I learned that I had a cholesterol issue a couple of years ago, I started using an activity tracker. So this is my VivoFit. It shows the number of steps, how many miles, tracks my sleep at night, which is kind of interesting because sometimes I don't sleep as well. So it's nice to have some record of that. But I noticed, I thought I was being active as a runner, and I noticed tracking my steps during the day. Some days after I was running, I was just sitting. And a lot of us are in sedentary jobs where we're just sitting, or we just habitually get used to that. And we need to sort of break out of that habit and just try to be more active. It'll help us a lot. It's also helpful in dealing with inflammation, just to take steps to rest more, stress relief, relaxation. We all have hobbies, things we love to do, and try to make smiles and laughter part of your routine. So I did want to mention Dr. Sears did a different version of the anti-inflammatory diet in this book, and he broke it down to the 6 S's. And so these are the 6 S's that he recommends that we try to keep inflammation at bay in our daily lives. The first one is seafood, especially wild Pacific salmon. I think Dr. Sears' recommendation is 6 ounces of wild Pacific salmon twice a week. He jokingly kind of puts on a prescription pad and suggesting that he would do that for patients, and for patients that are having health issues, or even if you're not, if you start doing that in a preventive sense, it'll help. So seafood's the first one. Number 2 is smoothies. And why do smoothies work? Well, they help reprogram the gut brain, and they're more filling. So that's what I'd say about smoothies. Thanks, Megan. Good to see you. Happy to help. Okay. Number 3 is salads. Go for the deep colors. I mentioned eat the salad before dinner. That's very helpful. It's more filling. It helps just kind of keep us from eating unhealthy things. So the salads before dinner. We talked about spices is number 4. And one of which is turmeric, having anti-inflammatory benefits, especially if you combine it with black pepper, black ground pepper. So when you reach for this, reach for the pepper too, and you'll have added benefits. Another one that Dr. Sears talked about, and there are others, is cinnamon. Cinnamon's in a lot of things that we cook, but we forget to put it in things like our smoothies. So in the top of my smoothie, before I close the lid, I'll put in the turmeric, the cinnamon, and I try to put ginger in there if we're not out of it. But we go through ginger pretty fast. So other spices that we talked about, let's see, turmeric, pepper, ginger, garlic, cinnamon, rosemary, and chilies. And you might notice sometimes, if you're if you are eating something, you put like paste picante sauce on it or something like that. It has the chilies in it. It kind of makes your nose run. It kind of does clear out your sinuses, and you find they're not as inflamed. So I think part of that is because there are chilies in there. Number 5, satisfying snacks. We should all try to graze instead of gorge, like I talked about earlier. And number 6, supplements. We talked about the omega-3 fish oil, especially from Alaska. It's very helpful. And the ingredient astaxanthin is what makes salmon pink. That some people are trying to buy astaxanthin off the shelf and using that in addition to omega-3. I haven't really tried the omega-3, but the astaxanthin. Other than in salmon, I haven't tried it as a supplement. But I find that the omega-3 fish oils are very helpful, and I think it's recommended to take those 3 times a day if you're trying to do that. So once again, I'm going to hold up the book for anyone watching this. Make sure that you get a good look at it. But the book that was the source for this was the Inflammation Solution by Dr. Bill Sears. And he's written more than 40 books. He's written some children's, books for raising children, books for improving your health. But it's very helpful in trying these techniques to make sure that that we try to take some kind of self-care techniques to make those part of our daily routine. And I think if we do, we can make a dramatic difference in improving our health. I gave you the example of how it's helped me with my asthma and bronchitis, really keeping asthma at bay. And I do have to see my asthma doctor next week, and it'll be interesting to tell her that I really haven't had any trouble. And that's kind of the opposite of where I was the last time I saw her. I was struggling with inflammation in my lungs and didn't realize it. The bronchioles were clogged up and the air was flowing correctly, and I couldn't figure out what the problem was. But some of it was inflammation, and I think a lot of that was due to just poor diet and nutrition. Maybe I just wasn't conscious of what I was putting in my body, or I was not being careful about avoiding. I talked about avoiding lactose, how big a difference that made, and that avoiding things you're allergic to or sensitive to, it just helps your body stay on more of an even keel. And then you're not having this constant inflammatory response to, oh, you ate something you're allergic to, or, oh, you had a bunch of lactose and you really shouldn't have done that. And we do find that we pay the price sometimes when we do that. So do want to welcome Chris, who joined us briefly here. All right. And let's see. And Jacob, thanks for coming. All right. Once again, this is Jeremy Murphy. I'm in Lincoln, Nebraska. I am a certified health coach for the Dr. Sears Wellness Institute. I am also a certified running coach with the Roadrunners Club of America. You can find my running blog at runningbruceshark.com. I'm doing health coaching virtually and in person now. I will be teaching classes called Primetime Health, and the certification that I got was based on this book by Dr. Sears called Primetime Health. And it was a series of about 4 classes. They were about 90 minutes in length. And, one of them dealt with inflammation and pain. One of them dealt with, making health your hobby. One was about creating your body's internal pharmacy. And I can't remember the other one off the top of my head, but three out of 4 without looking at the list is not bad. So I will be teaching classes like that online and in person for people that might be interested, just to try to help people in any way I can. And, my mission is to try to help people improve their health in any way that I can to improve their health and wellness. And we talk about the healthcare crisis in this country, and it can be resolved. And I think one of the ways it can be resolved is by all of us learning to take better self-care and to really manage our health better. So that's really all I have to share with you today. I'm happy to answer any questions or stick around if any of you want to talk a little more. So, but I'm glad to be able to share this with you. I want to welcome Aaron. Thanks for joining us. And once again, I'm happy to help anyone who might be dealing with health or wellness issues, inflammation, anything dealing with your health, trying to improve things. I do have, a special appreciation for dealing with issues of asthma and bronchitis. As almost a lifelong asthmatic, but as someone who's been able to manage it, run 15 full marathons, run a full 50K ultramarathon, and now I'm a running coach and a run streaker, which means just running a mile or more every day without interruption. And so I've been able to, I found that being more active, it helps keep a lot of the inflammation issues that I've had with asthma and bronchitis at bay. And I think a lot of you will find if you try to implement some of these changes, you'll notice a dramatic impact with reducing inflammation in your body. And then we're not dealing with all these diseases and conditions of endonitis. We talked about the conjunctivitis, gingivitis, carditis, bronchitis, colitis, dermatitis, and arthritis. And there are others, but that's primarily the itises that a lot of us find that we may face at some point in our lives. So welcome, Randy. Thanks for joining us. Jeremy Murphy, I'm a health coach in Lincoln, Nebraska, and we're just talking about health and wellness, trying to relieve inflammation naturally. There is a debate, or has been a debate, about whether that can be done or not. And I think doctors, the medical community, and scientific research is backing up the conclusion that we can relieve inflammation naturally, and we just have to be smart about what we're putting in our bodies, including seafood, smoothies, salads, spices that are healthy, satisfying snacks, and supplements like the omega-3 supplements that I talked about earlier. So feel free to contact me if you have any interest in talking about improving your health. You can reach me on Twitter at Jeremy P. Murphy is my handle. It's up here right under my profile picture shot. So thanks for joining us. Happy Friday, everybody, and have an awesome weekend. Appreciate all of you joining us. Take care. Do something good for your health today. And remember, if you ever have an inflammation issue come up in your life, try to treat it naturally. If your doctor tries to prescribe medicine for you, think about that course of action, but also look at what the side effects are. Look at what you could be doing in your body with taking You've got to do a risk-benefit analysis and figure out, is it worth the risk of the side effects? Does that outweigh the benefits I could get from taking this medication? So think about that, but realize that you have the tools in your hands to try to take control of your health and that if we all do that, we can have a dramatic effect on transforming the world and helping everyone improve their health in a meaningful way. So I'm wishing you happy health and wellness and continued success. Have an awesome new year and do something today positive to benefit your health. Have an awesome day, everybody. Bye-bye. Happy Friday.